We're going to start off with something very simple, and it's something that a lot of people don't really understand completely, which is that there's a difference between consumption, abuse, and addiction to drugs. What's kind of the pathway, and what are kind of the markers which say that, all right, this is where things have gone maybe a bit too far, this is where we can call something abuse, this is where we can call something addiction?
Well, that is a very important question and a very important discrimination to make. Actually, people confuse it a lot. Drug consumption is different than the drug addiction. It's very similar to diabetes. No one uses sugar with an intention to become diabetic. Similarly, no one uses drugs with an intention to become an addict to it. But the reasons are quite similar. Reasons to become diabetic and reasons to become a drug addict is quite similar. People who use drugs, whatever reasons, recreational purposes, instrumental purposes, or medicinal purposes, the reason for addiction is the same, and that is genetic. There are people who are genetically predisposed towards drug addiction and they get addicted to the drugs. And then there is a difference between the type of drugs as well. There are drugs who are highly addictive in nature, and there are drugs which are not that highly addictive in nature. For example, people who consume alcohol, 10% of them become alcoholic. But people who use heroin, 100% of them become heroin addict. And the same goes for cocaine. Like 96% of the people who use cocaine, they become addict. Methamphetamine, a new emerging drug, which is called ice as well in the market. And the street name is ice, speed, and crystal meth. And there are different names for it. That is a very extremely stimulant drug and very highly addictive, as much as heroin.
What exactly constitutes, when do you say that, all right, this is where someone is addicted? What is there a marker? Is there something which, there's a technical term that you guys might use?
Unlike other chronic diseases, test or the criteria for diagnosis of addiction is very different. It has nothing to do with the laboratory test. The symptoms of addictions are very social. The first symptom of drug addiction, if somebody finger points you, if they start talking about you that there is something wrong with this guy, he doesn't wake up in the morning anymore, he doesn't sleep in the night anymore, his weight is fluctuating, his behavior is changing rapidly, he's becoming very aggressive, and he doesn't talk sense, he's going into isolation. He is hanging out with friends who are a drug abuser. His studies and his grades are coming down. His performance in the job or in the business is coming down. His social relationships are getting affected. His relationship with the wife or with the siblings or with the parents or with the friends, they are getting affected. So these are actually the symptoms which should alarm the loved ones or the significant others to look for drug addiction in the loved one.
Well, that's fine, and a lot of the symptoms that you talk about are obviously things that will occur every day in someone's life, though. So my question over there is, isn't that a little bit vague? Because at the same time, someone who might be having certain mental health problems might be going through similar symptoms. Someone who might be having depression might be going through similar symptoms. Puberty, there's a lot of these types of things that go on.
Exactly. Actually, these are the symptoms for the family to watch into the matter, to look into the matter, to alarm them. It doesn't matter, maybe it is a mental disorder, maybe it is something, but there is something wrong and they need to look into it rather than ignoring it, rather than leaving it like, okay, with the passage of time, he'll get better or she'll get better. No, they need to look into the matter. The proper diagnosis is then done by the mental health professionals, but to go to a mental health professional, they need to watch for these symptoms, they need to identify and spot these symptoms in their loved ones, and talk to their loved one, talk to them what is wrong with them. Is it the drug abuse or is it some mental health disorder or whatever the problem is, they need to watch into these things, And then if they look for other things in the room, like they may find some cigarettes in the room, they may find small holes in their clothes, because when they smoke, it happens. They may watch for their hygiene. People with drug abuse or with drug addiction, they start ignoring their hygiene, they start ignoring their physical appearance and their health, their food, because what is the worst thing in addiction, that it takes over, it overshadows all your needs in life. people start ignoring their loved ones, people start ignoring their
Yes.
food, their mental health, their hygiene, their financial health.
Of course, it becomes a huge issue. But
Exactly.
we're going to talk more about that issue and more about the symptoms and a little bit more about people actually going to mental health professionals after this quick break. We just left you after having talked about symptoms and after having talked about having to go to people who are mental health professionals after recognizing those. But I have to ask you, Dr. Wyatt, are there going to be any sort of measures that a parent can take without seeming like they're intruding too much into their child's life?
There is a very thin line between protection of the kids and the freedom of the kids, right? When it comes to the self-harm behaviors, when there is some behavior that is affecting their children on one of the four aspects of their life, that is physical, mental, spiritual, and social, then the parent's responsibility comes in. It doesn't come in the umbrella of freedom anymore. It comes under the umbrella of protection. A child cannot harm himself with the label of freedom or with the tag of the freedom.
That's true, but again, like you said, a lot of these things are tendencies that do happen in children. A lot of these symptoms, for example, children not being able to sleep, children maybe having a dip in their grades, children having certain problems that do come up at particular times in their life. Is it maybe a little bit much? Is there anything else that they can do if they feel that that is the case?
This is what I always talk about. The parents, we need to raise our parents, then we need to raise our children, because the education and the training of the parents, and especially of the educational institution, and particularly of the teachers, that is very important. They need to know where to intervene in their life and where to give them some space and freedom. When it comes to the choice where the stakes are not very high, where the stakes are, for example, what are you going to wear, or what are you going to become in your life according to your aptitude, or what are you going to, who you are going to hang out with, again, definitely in the boundaries of your self-care. But other than those things, the parents should keep an eye on the children. They need to keep an eye, because the kind of exposure that we have these days, it can become very dangerous for the kids to face it by themselves. So the parents' intervention and the parents' supervision is very mandatory over there. For example, if it comes to the drug abuse, this is where the parents should show zero tolerance, and they need to talk to their loved one, and they need to seek professional help for that problem.
Again, this is the assumption that it is drug abuse, which, of course, that's something that can be contested. Like we said, there's a variety of things. But let's move on from that. It seems like very often there's stigma attached, and like you said, this is a problem of education. There's stigma attached to just the word drug in itself. So we see a lot of people who will equate something like, like you mentioned, consuming cocaine to smoking marijuana or hashish or things like that. Of course, there are things that are on very different spectrums. Should the stigma be equal for them, though?
There should be no stigma for any drug, actually. Addiction is a chronic disease. It's like diabetes. It's like hypertension. There should not be any stigma attached to it. Because of the stigma, people find it very hard to seek professional help, because they feel shame. How are they going to tell people that my kid is on drug, is suffering from drug addiction? So because of the stigma, they do not seek mental health professional help, and they try to solve this problem by themselves.
Yes.
And they are not professional for it. So actually, after many years of suffering and many years of damages, then they go to a professional. And a lot of damage that has been happened over that span of time cannot be reversed. They cannot be recovered. So the stigma, actually, we need to look at drug addiction as a disease rather than rather than a character flaw, or a responsibility disorder, or some other issue. We need to look at it as a disease, as a chronic disease. Like if we suffer from diabetes, we go to the doctor straight. We don't feel shame in that. If we develop hypertension, we go to the doctor very straight. But when it comes to drug addiction, there is a stigma attached to it, and we need to remove that stigma. It doesn't matter what type of drug the kid is using, because we have given these names to the drugs. For the brain, it is a chemical. It is a chemistry which stirs the chemistry of the brain. So for the brain, it is the same thing, whether it is cocaine or if it is hash or it is alcohol. the time duration of or the intensity of the problem may be different, but for brain it is chemistry. It's all chemical.
We'll pick up from there. We talked about how it's chemistry in the brain, but there might be some disagreements coming up after this small break. And we're back on the DBTV exclusive, and we talked before we left on about how different kinds of drugs are all basically chemicals that do affect your brain on different levels of intensity. Now, we're going to talk a little bit about preventative measures a little while afterwards. But before that, you've been talking constantly about how we need to go to someone who is professional, who can help us cure this disease that is drug addiction. And generally speaking, that is rehabilitative centers. Now, the government has actually been leading some efforts in the MATRC movement to actually try and have more public rehab centers being opened up as well. And you yourself are the founder of a commercial rehab center. What is the success rate of these rehab centers in the first place? Because we're talking constantly about how we need this and about how the government needs to put more money into this. But are these centers actually successful?
Actually, there are two parts of your question. One, the rehabilitation centers that exist, and second is the success ratio of those rehabilitation centers. First of all, we need to understand that the capacity that rehabilitation centers have in Pakistan is not even 1%. According to ANF, there are only 30,000 people in Pakistan who have access towards drug addiction treatment, whereas the users or people who are suffering from drug addiction is more than 10 million. So 30,000 out of 10 million have access towards drug addiction treatment. First thing. Second thing is the success ratio. According to the National Institute of Drug Abuse, the relapse ratio of drug addiction is very similar to that of diabetes and hypertension, which is 40 to 60%. And the reason of this relapse is because people go back after the abstinence period, after the treatment period, they go back to the same environment, to the same people, to the same triggers that caused them to drugs in the first place. So that's why I always stress on certain aspects in the rehabilitation centers and certain measures that need to be taken in the rehabilitation centers. And for that, we need to understand one concept. And that concept is that basically addiction is a memory. It is a euphoric memory, right? And this memory, it exists in our seed consciousness as a possibility wave. So that's why it cannot be removed. But we can develop new euphoric memories.
Of course.
We can form new euphoric memories which can overshadow the previous euphoric memories. And those new euphoric memories can be formed through games, outdoor games, different meditation exercises, yoga, that could be done through different activities and different hobbies.
There's a lot of these, but when it comes down to it, I'm sure it's also very difficult. So what exactly is the success ratio at the end of the day?
I think the success ratio in Pakistan, it varies rehab to rehab, segment of society to another segment of society. Yes. And then the history of the drug addict patient. For example, if somebody got addicted to prescription drugs, which he actually didn't start for a recreational purpose, now the success ratio in those drug addicts is very high because it was an accidental addiction. Yes. But people who start using drugs for recreational purposes, their ratio is very low. And then the people who started using drugs for instrumental purposes, for example, somebody wants to reduce weight and the person started using methamphetamine and got addicted to it. Or somebody wants to study for longer periods of time and started some stimulants, then their ratio is higher than the people who use it for recreational purposes, and accidental addiction ratio is then higher than the people who use it for instrumental purposes.
Of course.
So it varies, but it falls between 40 to 60%.
Well, 40 to 60% is obviously a good number, and hopefully the government will be able to put more resources into the development of more such centers in order to make sure that the epidemic that is spreading within Pakistan can at the very least be slowed a little bit. That being said, this has been DBTV Exclusive. Thank you all for tuning in, and this is Mamun Sabri saying Allah Hafiz.